good matcha. A good matcha latte sometimes is all that you need in life. Thank you. Thank you, Paris Baguette. All right, here we are, back at it. Social work exam prep. Welcome. Today we're going to go over SNRIs. Serotonin, norepinephrine reuptake inhibitors. So sit back, pull out a notepad, and enjoy. We're going to do another Psychopharm. This is another part of the multi-part series. No, I don't know how many parts there will be. We're just going to do all the meds. What is an SNRI, or a serotonin norepinephrine reuptake inhibitor? So this medication, these are antidepressants. They're often used, of course, to treat depression, as I said, but also anxiety and panic disorder. I've also seen them sometimes used to treat nerve pain, but for the sake of the test, they are an antidepressant. So if it asks you what type of diagnostic work would be done in terms of the diagnosis of depression, that's what you're going to pick if that's the answer. So generally, they're actually pretty effective in treatment for irritability, sadness, and anxiety, similar to SSRIs, and have a similar mechanism for how they work. With these medications, they affect the neurotransmitters that send chemical messages in the brain, aka a neuron, basically sending an email. The SNRIs block the reabsorption or reuptake of serotonin and norepinephrine in the brain. This allows basically the email to make it into your inbox and not your spam folder. When the reabsorption is blocked, more of these chemical messages, the neurotransmitters, are available to ease depression and anxiety symptoms. So in a similar sense, the selective serotonin reuptake inhibitors are just focusing on serotonin. These are focusing on serotonin and norepinephrine. So generally remember that you need to educate your patients, clients, etc., to give these medications 4 weeks before they start to notice if it is having any effect or making any changes, and be sure to educate on the side effects and whether these side effects are unbearable or serious symptoms begin to develop. Don't stop taking the medication just because in the first 2 or 3 days you don't feel it working per se. It does take time to build up to therapeutic levels in your system. So make sure that, you remind patients gently to take their medications as prescribed, or talk to the prescribing provider before just giving up, assuming it's not working, or if they are having really bad side effects, to definitely talk to the provider about it and go over what next steps are. The FDA-approved SNRIs are desvenlafaxine or Pristiq, duloxetine or Cymbalta, venlafaxine or Effexor, extended release as well, or levominocypran. I don't use that medication often in terms of just everyday talk, and it's not one that's definitely I see used, so I don't have the ability to pronounce it very well, so I apologize. But the brand name is Fetzima. Common side effects that you might see in an SNRI would be upset stomach, dry mouth, dizziness, headache, or sweating. And then other side effects that might not be as common but could be seen are tiredness, constipation, trouble sleeping, lessening of the sexual desire or just trouble reaching completion, and then a loss of appetite has also been seen. So in summary, make sure that you provide education on the medication with your patients or clients within your scope of practice, of course. And if they have a ton of questions, encourage them while you're doing the education to write those questions down, whether it be on a note on their phone or on a physical piece of paper, so that way they are able to ask the ones that they couldn't get answers from you about from their provider. You can provide general information and then start to refer them back to their PCP, their psychiatrist, or their obstetrician if they're pregnant, breastfeeding, or trying to become pregnant and working with someone there. Oftentimes I do see for antidepressants and anti-anxiety medications that obstetricians will work on those symptom managements in terms of prescribing SSRIs or even SNRIs when appropriate and based off of the symptoms they're experiencing and where they are in their pregnancy journey. So make sure to refer them back to any of their providers that are prescribing, or if this is someone who is interested in starting a medication, go ahead and refer them to their primary care to start. If they are not with a psychiatrist currently for something else, you can refer them to a psychiatrist, but sometimes people feel a little more comfortable with their primaries as the first stop. And then if they are, again, pregnant, breastfeeding, or trying to become pregnant, have them refer back to their obstetrician for any kind of recommendations on specific medications and how to handle that during pregnancy, as it might be different with patients who are either going through fertility processes, who are pregnant, or who are breastfeeding.